Swadikap and good afternoon. Today is Saturday, the 6th of February 2021, and what was shown just now was a clip in the Thai version about the Moshana application for easy understanding about the how to use the application, which is very, very useful, as we mentioned quite often. And first of all, thank you to Dr. Boom, Dr. Pen Papayong Tragoon, who gave us the briefing today in the Thai edition just now. So first of all, I've been asked by many people to to show a list actually of useful contact numbers relating to COVID information, hotline numbers, issues like that, so people can ask and inform about their concerns and ask questions on COVID issues. So as you see on screen now, we have a compiled list of useful contact numbers as follows. The 1111, that's the government house, and the following numbers are from the Department of Disease Control, the National Health Security Office, Emergency Medical Institute of Thailand, and the rest. So these are the numbers, the hotline numbers, which you can avail of and use for any inquiries that you might have. So before going to the general situation and number of cases, just to mention on a global level, now there are around 400,000 to 500,000 new cases of COVID per day. We continue to monitor the global situation, which is perhaps around 105 million cases of infections already, and to evaluate the extent to which the COVID-19 vaccine has brought down the number of cases. That's a global level. And for Thailand in particular, we have new confirmed cases, which is 490, and we'll have a chart coming up for you very soon. New confirmed cases, 490. Out of that, around 412 cases are from active case finding. So the majority from active case finding. New recoveries today, 943, which has actually surpassed the number of confirmed cases for today on a day basis. 943 versus 490. Cumulative in Thailand since last year, over 23,000. Cumulative recoveries and discharged, over 16,000. Current cases under treatment, active cases under treatment, 6,781. No new fatalities, making the cumulative fatality as 79. Just some observations from the cases that we have today. 67 cases were detected in hospitals and healthcare facilities. Out of these 67 cases, majority from Samut Sakhon, the rest from Bangkok, Tak, Samut Songkhram, and Phetchaburi provinces. From the active case findings today, which is 412 from active case finding, we have the majority, 410, from Samut Sakhon, and the rest from Samut Songkhram and Samut Prakan province. As you can see, health authorities continue to conduct active case finding in Samut Sakhon and in at-risk districts in Bangkok. Officials have revealed that the situation in Samut Sakhon is improving with proactive testing of 140,000 workers in 845 factories to date, meaning that officials have been able to successfully pinpoint factories that need close monitoring. Health authorities are now conducting active case finding missions to the thousands in Samut Sakhon today. Lastly, 11 cases today are from overseas, which is comprised of 10 cases from the within the state quarantine system, and 1 case who did not enter the state quarantine system but came from overseas, abroad, meaning illegal entry through natural borders of Thailand. So that is being dealt with. So a total of cases coming from abroad, outside of Thailand, is 11 cases, majority of which, of course, into our state quarantine system. The overall situation for the past week, I'll recap on that, which is from the 31st of January to the 6th of February. In overall, it has improved. You can see on the map of Thailand on screen now that most of the country continues to be colored in green or in safe zones. Just to dissect this a bit, 14 provinces in white, as you see on screen, in white, have reported still no cases at all during this new wave. 47 provinces in green, as you see on the map, have no reported cases for 7 consecutive days, that is 1 week, or more than 1 week. 6 provinces in yellow, no reported case over the past 5 to 6 days. 2 provinces in orange, That's only a few or one province there you see on screen. In orange have reported no cases in the past 3 to 4 days. And 8 provinces have been detecting cases over the past 1 to 3 days. That's the one with the darkest color, yes, on screen. So during this new wave of infections from the 15th of December 2020 until the 6th of February 2021, we have had 18,897 accumulated cases. Now, that's specifically for the new wave since December, over 18,000, almost 19,000. But overall, counting with the other cases in the first wave, that's over 23,000, as mentioned. So for this new wave of infections, the overall situation for this current wave of infections is still manageable. However, there has seemed to be a case that has arisen in Bangkok where asymptomatic migrant housekeepers could have possibly spread the virus to a 95-year-old male person who is bedridden. So you see on screen there the possibility of this scenario, which we are still investigating. So 3 asymptomatic migrant housekeepers possibly spreading it to a bedridden person, a male, aged 95. So this means that health authorities would have to maintain their active case finding in migrant communities in Bangkok to prevent local transmissions within the community and further transmissions in society. So this case in particular you see on screen is still under investigation, so we have not yet an exact timeline of this, and we'll be investigating this in detail for this particular case in Bangkok, which involves actually a very aged senior citizen, 95, but bedridden, not in contact with many people because he's bedridden. So investigating the case in other provinces, that continues, investigating cases in Mesot in Tak province, where patients have spread virus to family members. The Ministry of Public Health will provide further details this afternoon on this investigation of the case in Mesot, Tak province. So Bangkok and Mesot for you. So I'd just like to stress that the CCSA continues to underline the importance of the basic precautionary measures for everyone on a daily basis, to report how failure to practice or abide by the measures can pose as a risk to your community, especially to vulnerable groups, senior citizens, or older people, or within your families. So just on a little bit further on the situation in Bangkok, just to highlight on the general COVID situation in Bangkok, we'll have on screen for you the top 5 districts in Bangkok with the highest number of infections as follows. First is Bang Khun Tien district, 151 cases. So this is dissected by the actual districts in Bangkok for you, the way of presentation for this slide in particular. Second is Pasir Charoen district, 49 cases. Third is Jom Thong district with 33, Bang Khae 30, and Bang Plat district at 27 cases. In Bangkok, social gatherings were most often linked to many of the local transmissions. Other cases were linked to workplaces, mostly in offices, where co-workers were in close range of each other and did not wear masks, and in particular during meal breaks, where co-workers also shared utensils. Just to recap also on various relaxation measures we have had in Bangkok, effective from the 1st of February already. So here on screen, some Q&As on the measures in Bangkok, courtesy of the Public Relations Department, on what is allowed and what is not allowed. For example, customers allowed to dine in at restaurants until what time? So it's 6 a.m. to 11 p.m., 0600 to 2300 hours. And after this hour, you can order takeaway service for establishments, restaurants that have that service. Second, restaurants. Are restaurants allowed to sell alcoholic beverages? No, consumption of alcohol in restaurants still prohibited. However, they can be sold in supermarkets and convenience stores in specified times or through takeout. Are swimming pools in condominiums allowed to reopen? Yes, but it is suggested that users strictly follow the precautionary measures and keep a physical distance with others. And this also goes for the administrative office of each condominium as well. Are boxing and football competitions allowed to be held? Yes, but without spectators, and the athletes must strictly observe various sanitary measures. We mentioned yesterday, and you might have heard quite often about the term bubble and seal strategy. Seal and bubble, you can see on screen, which many times we have mentioned already last week, but some might be still unsure of what it fully entails. So basically, the Health Ministry implemented this strategy to curb the spread of coronavirus, COVID, in big factories in Samut Sakhon province. The bubble method in particular, is being used in factories where employees reside outside the factories. In this case, officials will strictly monitor and regulate the travel and movement of workers all the way from their dormitories to their workplaces to prevent them from wandering off and spreading the disease, possibly through other locations. The seal methods, in quotations, the seal method is being used in factories which provide on-site accommodation for workers, which means that employees cannot leave the premises. So the bubble and seal strategy is expected to bring local transmissions under control within 28 days. Nevertheless, health officials will continue to conduct active case finding in locations where it is deemed necessary. And if infected persons are found, they will be isolated and transferred to appropriate places where they will receive treatment according to their symptoms. Just some additional points before ending today. As you're aware, the fact that the majority of local transmissions now have been proven to come from social gatherings and parties aside from within the office. So it's important to keep your guard up, continue to keep your guard up and protect yourselves and your loved ones from infection by wearing masks, washing hands frequently, avoiding crowded areas, and keeping a social distance. DMHTT. Just for some students to prevent COVID. So you can see from this infographic, the Health Ministry recommended that parents should prepare essential items for children to take to school so as to reduce the risks. For example, extra face masks, because children often lose or misplace their masks and other items. Alcohol gel, of course, a small pack of tissues, and their own, of course, toothbrush and toothpaste, because some children have to do that, brush your teeth during school times. So in addition, these items should be put into a Ziploc bag before putting them in the school bags to keep them sanitized and prevent dust. So parents and teachers should also encourage school children not to use or share any personal items with friends and to wash their hands and disinfect their hands regularly. So lastly, another message from the World Health Organization on small act of kindness. For many of us, the world seems pretty dark and hopeless. We're glued to our screens. We hope for good news, but more often than not, we end up with reading bad news, reading reports that fill us with anxiety, fear, and helplessness. The CCSA, here, all of us have faith and remain confident that there is no shortness of goodness, no shortness of kindness and heroism in humanity, and as the world battles COVID virus together. So just a quote here, small acts of kindness can have a big impact on others during the pandemic. Small acts of kindness can have a big impact on others during the pandemic. So thank you very much for your attention today. Have a very pleasant rest of the weekend, and we'll see you again tomorrow. Stay safe. Thank you. สวัสดีครับ